Good morning, everyone. Thank you all for making the travel, and we have participants from 14 different countries traveling up to 20 to 22 hours to get here to Morgantown.
This is definitely a place you could come to get a sense of what's being done in the field and begin to learn how you could take it home and do it at your site. I have a vast experience in aortic surgery and aortic valve surgery, but I think learning about a different approach to doing it is really phenomenal. And this approach is this isn't innovative. This is next level cutting edge therapy.
It's the first time I've seen it actually performed live.
The first patient doing very well. Actually, we'll look here. Him is starting to walk.
It's eye-opening as far as what can be done, and the skill of these guys is amazing.
They are actually laying the foundational roadmap from how to get from A to Z, and it makes the path so clear.
We want to share experiences and make sure that everybody is doing this in a safe manner. This is a global community, and we want you all to be successful.
It's been really a good meeting for collaboration and learning from each other, showcasing what can be done with the robotic platform.
It's not just a surgeon who knows how to use the robot, goes off to the fringes and try to do something, but rather to create a team and to be thoughtful about it and understanding that everyone in the room has a role.